Good afternoon, friends. This is a talk on molecular therapeutics. This will be an interesting talk not only for orthopedic surgeons but for people from other specialties too. The theme is transforming musculoskeletal care through innovation. I am Dr. L. Prakash, and in the next 45 minutes, I will explain what molecular therapeutics actually is. Let us start with a simple example which is familiar to almost all orthopedic surgeons. A stress fracture of proximal third tibia. Of course, there is an arthritis of the knee as well, and there are many ways to treat this. This is one which is described in the textbook, where they have put a medial plate and a lateral plate, and the radiologically fixation looks satisfactory. Dual plating is not unconventional. However, depending on the type of incision, if the skin area between the medial and lateral plates is not adequate, something like this will happen. This patient who came in for a stress fracture was advised amputation by more than 5 orthopedic surgeons. For the rescue came molecular therapy, and after a single ozone bagging, you can see how the skin has become healthy and the wound has started showing blood red situation. He was then treated with a plate removal, locking nail, compression, and a full thickness graft by a plastic surgeon. So this was the internal part, and this was the external part, and eventually both the skin and the fracture went on to heal well, to the great relief of the patient, who could avoid amputation. This is the final picture of the patient, and this is the final radiograph of the patient. Another case. This was a non-healing ulcer, diabetic, renal failure. On the right has the WhatsApp chat by the referring doctor, and again this patient was advised below knee amputation in one place and antibiotic bone cement in the other place. Patient was unwilling for either, and so we started. This is a conversation which was sent to me by my friend, that one colleague had advised for below knee amputation, the second one have advised an antibiotic cement. They finally came to me. This was the picture, and you can see the soaked bandages downstairs, and that is the amount of pus and purulent discharge that each dressing had produced. This is after injecting ozone around the edges of the wound, ozone bagging, and a section of mega MAHT. The picture is in a week where the patient had to dress the wound in between with ozonated glycerin. Everything started filling up from bottom up, the discharge reduced and finally abated, and the wound healed eventually. Now, from the one deep wound on the left to the other on the right, the total duration taken was just 3 weeks. Let me give you another example. This case had a bad wound, infected sloughing on the sole of the foot. we can see the image on the right is after one bagging and 2 days of ozonated glycerine application. And we can further see that it took only 12 days for the wound to heal. Again we can see a bad non-healing ulcer. This resulted out of excision of a gouty tophi, and then the stubborn ulcer refused to heal, but once ozone was started and hydrogen and nutraceutical drips were started for the patient, it started healing, and it took only 14 working days for the same to heal. Just 14 days. So, it took only 14 days for the ulcer to heal. At this stage, I would like to give a disclaimer that not all cases shown here have been done by me, but many cases or most of the cases have been sent to me by our friends and colleagues who are using molecular therapeutics. This is another case. A lady of 40 had chicken pox for 7 days. After one molecular hydrogen infusion in the night, we can see the effect the next day. The entire lesions have dried up, healed, and look very, very good. The patient also had good relief from her symptoms. Now, see this. This is a case of human papilloma virus, and a single EBOO was enough to drop the warts and cure her of all the lesions. So dramatic and good are the results. And the another case of buccal cancer with leukoplakia was just on ozonated glycerine wards under the lower around the area, and in less than 2 weeks everything healed up comfortably, well and full. Now look at this. This is a case of one of my friends, Dr. Sahotra, and this was a bone deep diabetic non-healing ulcer. The fellow had already undergone a ray amputation for another non-healing ulcer on the 4th metatarsal head, and after ozone bagging, MAHT and EBOO, in a period of 4 weeks, the ulcer, which was stubborn for about 6 to 8 months, healed comfortably. Another similar case, non-healing ulcer, second ray amputation done previously for a similar condition, was again advised a midfoot amputation because of that stubborn ulcer which refused to heal for a long time. Had molecular therapeutics, ozone and hydrogen, the wound healed. Now the patient is back to the fields without any footwear, and the wound continues to remain healed. Now time for a rare case. This is a case of yaws, now no longer prevalent in the world. This was refused treatment even in the United Kingdom. The case is one of my friends, Dr. Dipendra from Nepal. I just asked him to scrape everything and apply ozonated glycerine and ozone bagging and give the patient MAHT. That was done, and a 23-year-old problem was solved in 3 months. So this is the miracles of the modern molecular therapeutics. And of course, the hot subject of today, which is avascular necrosis of the femoral head. Both COVID disease as well as COVID vaccines have caused a major significant sprout in the incidence of avascular necrosis of the femoral head, and ozone MAHT or extracorporeal blood oxygen ozonization with Mukherjee regime has saved over 180 hips from total hip replacement in my own hands. The average hip that comes to us is somewhat like this, with a badly affected head with an impending collapse, sectoral in the weight bearing area, and normally after about 18 months of treatment the head revascularizes, joint space remains retained, and there is no collapse of the femoral head. Another case, this one is a FICAT grade 4 with impending collapse, and you can see that how the X-ray shows progressive improvement, joint space is maintained and the hip becomes practically normal. 2 MAHTs, 1 EBOO, Mukherjee regime for 12 months. We however continued Mukherjee regime for 18 months for full relief. These are the before and after pictures of a medical professor who had a pancreatic ductal adenocarcinoma and had come to me post chemo and radio with almost a bald head with 3 liters of ascitic fluid. The same was aspirated and removed. Here is the view of the ascitic fluid being aspirated. He was cachexic, anemic, general condition was very poor, and we gave him 2 sessions of EBOO spaced about 2 months apart. So, this is the procedure on hand. We can see that blood from the donor site, which is darker in color, and once it is ozonized, the much brighter red blood is flowing into his body. This is the testimonial given by him, and I will let him speak his.
Now you can tell.
I myself, Professor Dr. MD Medicine, have taken EBOO from Dr. L. Prakash after chemo of pancreatic adenocarcinoma. After that, the side effect of chemo dramatically reduced, and all hair grow well, scalp hair, and all side effects like pains, cramps reduce, and ascites was at that time. Now ascites gone away after triple CT scan. There were no ascites at all.
Excellent.
These examples just tell us that molecular therapeutics produces real, wonderful, quantifiable, reproducible results in a wide variety of conditions. A WhatsApp chat very recently where somebody who had a resistant psoriatic arthropathy, and just as I had taught 5 sessions of mega MAHT, she was off her costly biologicals, lesions reduced by 60%, and her rheumatologist himself was shocked. This is the magic of molecular medicine. What is molecular medicine? use of natural molecules which are either unavailable on earth, alien, or which are available on earth in trace elements. What are these molecules that produce such seeming miracles? The two common molecules which are the forerunners and used commonly for molecular therapeutics are ozone O3 and hydrogen H2. What is EBOO, MAHT or hydrogen infusion? This slide will show you, the next slide will show you the procedure of major autohemotherapy being performed on myself. What is EBOO, MAHT or hydrogen infusion? Here is an example of me having my own MAHT. We have hypernized the bottle and the transfusion system using a thin vein. We have collected the blood in a bottle, appropriate adequate dosages of ozone is taken in a syringe and retransfused back to the subject, that is me. The whole procedure takes less than 6 to 8 minutes and is very comfortable. Now, what are ozone and hydrogen? Ozone is a naturally occurring molecule, though in trace quantities. Normally, when there is lightning, you smell the faint freshness of new rains, or when you go to waterfalls, where you again smell the freshness. That faint freshness is ozone. We live on a polluted earth today. The ozone layer in the stratosphere detoxifies the toxins and keeps us safe. And if human life exists on earth today, it is only because of the protective ozone layer. Ozone is produced in our clinic with an ozone generator. Ozone does not cost money to produce. Pharmaceuticals cannot bottle or sell it as a product. It is not a commercial product and benefits nobody except for the patient. And thus there has been a lot of stiff opposition by the pharmaceutical lobby, US FDA and many other people about ozone. All you need is a special pressure regulator, which is dry pressure regulator capable of oxygen flows up to 1/32 of a liter, and a simple B type oxygen cylinder. This is a video demonstration of Mark 9 advanced ozone machine. Good afternoon friends. This is a short video demonstration of IAOS Mark 9 advanced ozone machine with 9 switch controls that will work from very low to very high concentrations. This machine is one of the most advanced machines in the country and internationally, and can run continuously for 21 days and 21 nights. There is a chart on the top, and the highest ozone concentration is 125 micrograms per ml, and
this comes
this
with
comes
a power
with a power supply
unit,
unit,
a
a
machine
machine
capable of
long
long
continuous
continuous
action,
action, and a
and a
regulator
regulator capable of
up to
up
1
to
by
1 by
32nd of a
32nd of a
liter,
liter,
which will
which
go
will
up
go
to
up
4
to 4
liters of
liters of
oxygen.
oxygen.
For medical
For
grade
medical grade
purposes,
purposes,
we
we
use
use
very,
very,
very
very
low
low
concentration,
concentration,
very, very
very, very
low
low
volume,
volume,
which will
which will
produce a very
produce a very
high
high
concentration of
concentration of
medical ozone.
medical ozone.
The
The
ozone
ozone
oxygen
oxygen
cylinder
cylinder
is connected
is
with a
connected
pipe
with a
with a
pipe with a
pressure
pressure
regulating
regulating
attachment.
attachment.
When
When
accidentally
accidentally the pressure
of the
of
cylinder
the
becomes
cylinder becomes
high,
high,
the machine
the
is
machine is
protected by the
protected by the
detacher.
detacher.
The power
The
cord is
power cord
plugged
is
in,
plugged in,
and once the
and once
switch
the
is
switch
switched
is switched
on, we can see
we
the
can
red
see the
light
red light
glowing, which
glowing,
shows that
which
the
shows that
machine
the
is
machine is
operational.
operational.
We have to
You have
first
to first
adjust
adjust and
the
put the
regulator
regulator
at the
at the
desired
desired
desired level,
desired
which is
level, which
in this
is
case
in
1
this
by
case 1
8,
by 8,
and then we
and
can
then we
keep
can
moving the
keep moving the
switches
switches
to decide
to
the
decide the
concentration.
concentration.
Switch
Switch
9 at 1
9
by
at 1 by
8
8
of liter
of
per
liter per
minute
minute
gives
gives
about 100
about 100
micrograms,
micrograms,
which is enough
which is
for
enough for
most
most
applications,
applications,
including
including
intradiscal
intradiscal
and
and
intra-ozone,
sorry,
in
and in
MHT
MHT
and
and
intravascular
intravascular
and
and
EBOO
EBOO
applications.
applications.
The top of the
The top of
machine
the
has got
machine has
two
got two
outlets, one
outlets,
for
one for
ozone
ozone
out
out
and one for
and one for
vacuum in.
vacuum in.
Once the machine
Once
is
the
switched
machine is switched
on,
on,
we can
we can
attach a
attach a
syringe,
syringe,
and we can
and we can
see
see
in real
in real
time the
time the
speed with
speed
which
with which
the
the
syringe is
syringe
filling
is
up.
filling up.
This is 1
This
by
is 1
8
by
of a
8
liter
of
per
a liter
minute,
per
which
minute,
means
which
in
means in
8
8
minutes
minutes
1
1
liter
liter
of
of
oxygen
oxygen
will flow
will
out,
flow
meaning
out, meaning
100
100
micrograms of
micrograms of
ozone
ozone
per
per
ml.
ml.
To test
To
whether the
test whether
ozone
the
is
ozone is
proper and
proper and
concentrated,
concentrated,
we will just
we will
blow
just
it
blow
on
it
a
on
glove,
a
and we can
glove, and we can
see
see
that holes
that
are
holes
made.
are
This is
made.
called a
This is called
latex
a latex
test,
test,
and even a
and even
slight
a
touch
slight touch
of this sort
of
of
this sort of
ozone
ozone
will
will
melt the
melt the
latex.
latex.
We should be
We
thus
should be
very
thus very
careful in
careful in
using
using
rubber and
rubber
plastic
and plastic
containers.
containers.
Once
Once
we finish
we
that,
finish that, we start
vacuum
vacuum
testing. This is
testing. This
how
is how
vacuum is
vacuum is
generated.
generated.
Vacuum is
Vacuum is
needed
needed
only when
only when
MHT
MHT
bottles
bottles
stop
stop
sucking the
sucking
blood
the blood,
and the vacuum
and the
unit
vacuum
gets
unit
low,
gets low,
or
or
when we are
when we are
attempting
attempting
multi-pass
multi-pass
ozone
ozone
major
major
autoimmunotherapy.
autoimmunotherapy.
The switch
The
on the
switch
left is
on
the
the left
vacuum
is the
switch,
vacuum
the
switch,
switch
the
on the
switch
right
on the right
is a
is a
knob.
knob.
Now
Now
here is
here
a
is
way
a
to
way to
show
show
how
how
ozone is produced for
for
ozonating
ozonating
water.
water.
The tube is
The tube is
connected.
connected.
The
The
knob is
knob is
put at
put
switch
at switch
9,
9,
and
and
the
the regulator is
1
put
by
at 1 by
16th or 1 by
16th or 1 by
8th.
8th.
This
This
is now
is
allowed
now allowed to put
into
into
water
water
to
to
ozonate
ozonate water.
This
This
ozonated water
ozonated
can be
water
used for
can be used for
drinking,
drinking,
for
for
washing
washing
wounds,
wounds,
for
for
soaking
soaking
gauges
gauges
before ozone
before ozone
application,
application,
and for
and for numerous other
applications
applications
about which you have
about which
been
you have
taught in the
been taught in the
course.
course.
You can
You can
contact
contact this WhatsApp number
for
for
further
further
details
details
about
about
the
the
procedure and the
procedure in the
machine.
machine.
Hope you are
Hope you are
enjoying the use of
enjoying
the
the use of the
machine.
machine.
Thank you very
Thank
much.
you very
Have a
much.
nice
Have a
day.
nice day. Thank Ozone can be administered by many routes and causes many beneficial effects. Given intra-articular, it causes gaseous arthrodiastasis in stiff joints. You can see a wrist joint in a rheumatoid arthritis patients with almost no radiocarpal space, and immediately it becomes distended. You can see another wrist joint which has been distended in a similar way. A nearly fused elbow, again with ozone arthrodiastasis, gets pulled apart. The movement, the one below shows a flexed flexion deformity and the one above shows a complete extension. In a similar manner, we can see the wrist movements have increased dramatically to the satisfaction of the patient. Next is an ozone arthrodiastasis of a hip joint. You can see in real time under a C-arm that when the blast of ozone is given, the hip opens up and this gives immediate detachment or tearing off of the fibrous adhesions and dramatic improvement in the movements. Even in advanced arthritis like this, where the patient is refusing for an arthroplasty, we can distend the joint. The closed capsule allows stretching and gaseous arthrodiastasis of the hip joint. One more example of these, not all are my cases. They have been shared to me by many of our friends who are practicing ozone after learning the system from IOS. Next comes hydrogen. Hydrogen is a wonder molecule and this can be combined with ozone to produce hydrozone. Though hydrogen is the most abundant molecule in the universe, it is not found in its native form on earth. It is just two atoms of hydrogen, H and H, and make H2, which is the lightest and smallest molecule in this universe. Molecular hydrogen is a new miracle molecule in modern medicine. It is the strongest antioxidant known so far. Numerous clinical studies the world over have found that molecular hydrogen is very highly beneficial in a wide range of conditions, from severe hypertension to post-malignancies chemotherapeutic toxicity. We can see our colleague who sent me a message that after single infusion his BP came down from 141/92 to 115/75, and he also sent me a video of the procedure, and here is the video. We can see the machine in operation and we can also see the bubbling. The monitor behind shows 147/93 as the BP during infusion, 146/97, 98 while the hydrogen is being infused, and this is immediately after the procedure. After 20 minutes we can see the pressure has come to 115/75. To produce 99.99% hydrogen, a hydrogen generator is needed. This is a hydrogen generator and our IOS machines are tested, calibrated and certified. This short video shows the unboxing of IOS hydrogen machine. There are a lot of accessories, breathing tubes. The main machine is positioned on a stable stool or a stand. The machine comes with wheels that can be used to move it from one place to the other. The particular machine demonstrated here produces 900 ml per minute, which means 600 ml of hydrogen and 300 of oxygen. More powerful machines are also available. The wheels are locked, the machine is stabilized in a proper position. We need medical grade distilled water. Do not use mineral water or ordinary water. The machine splits H2O into H2 and O2. The level of hydrogen, the distilled water, is shown on an indicator on the left, and one must ensure that the precise amount of water is poured into the machine and there is no overfilling of the machine. Once the desired level of water is inserted into the machine, we plug it in, switch it on, and the machine will produce 600 ml per minute of 99.9% purity hydrogen gas. It's touch control, and we can control the volume, the concentration, the speed and the duration. Next is a demonstration of intravenous infusion of hydrogen bubbled nutraceuticals. We have increased the timing and concentration to the desired levels and switched on the machine, and hydrogen starts coming out of the tubes. The ejection point of the tubes, which is a combination of the Y junction of the two 300 ml spots, can be now connected to a drip set, and the same can be pushed at the lower level of a 100 ml saline bottle. As we are injecting close to 600 ml per minute in a 100 ml bottle, it is essential to have a large air vent to allow the excess hydrogen after saturating the bottle to escape through an air vent. This is an ordinary drip set. The spike end of the bulb is cut, and then the tip is introduced into the exit port of the hydrogen machine. The hydrogen will enter through the bulb and then go up and be bubbled to the bottle. We connect a saline set, a needle, to the tip of the set, and this is pushed in, and we can see that hydrogen is bubbling into the bottle. The nutraceuticals will vary from patient to patient. We can have high dose of vitamin C. In post malignancy, it may go up to 20 to 30 grams, and routinely 5 to 6 grams of vitamin C. Then vitamin B complex, vitamin B12. Do not use cyanocobalamin, but use methcobalamin. All these nutraceuticals can be injected through the top of the bottle. N-acetylcysteine, NaC, NaD, magnesium, B complex, B12 can all be injected, because all these antioxidants are synergistic and will augment each other's effect. We must ensure that at least 10 minutes of hydrogen bubbling happens before we start infusing the patient, because that is the minimum amount of saturation required for a 100 milliliters of hydrogen. So, all the nutraceuticals are being added to the mixture, and the same is pushed to the bottle to ensure that we have a perfect solution to administer. As the space in the bottle is a little less, we attach the transfusion set to the lower part and prime the set so that we get space for injecting the rest of the nutraceuticals. Glutathione, if injected, has to be done at the very last moment, because it is a very rapidly oxidizing molecule and thus will lose its potency if it is given over a long period. We can use the thinnest cannula, and once the vein is approached, the drip starts, we can see the bubbling of hydrogen not only in the 100 ml saline bottle, but also in the bulb where hydrogen is seen bubbling. We ensure that the vitamin C, which causes irritation if pushed very rapidly, is going at the desired speed. The venflon is connected and attached, secured, the process of the drip is started, the tourniquet is removed. Meanwhile, we take the glutathione and dilute it. So, this is the glutathione which is hydrogen packed, manufactured by the IOS. You can see it is caked. The same is now mixed with the available saline and mixed with the powdered glutathione. One must ensure that the highest quality glutathione is used, because most of the non-caked and powdery glutathiones are impure, adulterated with fructose. So, the glutathione is injected into the bottle and we allow the whole drip to be slowly administered to the patient. Just to ensure that it is only real hydrogen we are producing from the machine, there is something called a flame test, and this flame test will involve lighting the tip of the needle that comes out with the flame, and we can see that this will burn the tissue papers. The flame will be elegantly burning, and you cannot extinguish the flame by blowing on it. You need to actually dip it into the water. These drips are pretty expensive abroad, and we can see that in UK they have got a menu card for IV drips, and limitless drip is 850 pounds. IV bubble hydrogen infusion, supersaturation and infusion of hydrogen enriched saline is a useful augment and a part of molecular therapeutics. This is me having my hydrogen infused nutraceutical solution, and you can see the tiny micro bubbles in the tube. I have felt a dramatic improvement in my energy levels and a speeding up of my activity levels, increase in energy reserves, all because of direct molecular hydrogen going into my body. You can see that my activity level of active calories jumped from 450 kilocalories to 708 within a period of 7 days immediately after infusion. And in November month, about a month back, I just checked and I found that I did close to 923 active calories, 12.75 kilometers and 18,000 steps, which at my age of 68 seems reasonable. You can see at the top that all the rings are closed, meaning every day I am exceeding my level of fixed exercise. Now comes, how do these molecules act and how do they produce such wonderful results? The whole theory is about mitochondrial shock. To understand this, we need to delve deeper into the mitochondria. Mitochondria is known as the powerhouse of each individual cell. However, we know that mitochondrial genes are entirely different from cellular genes. However, the surprising fact is that when I talked to many orthopedic surgeons during a recent conference, less than 10% knew that mitochondrial genes are different from cellular genes. In the picture shown above, shown to the left side, each person will have a different cellular DNA, but the mitochondrial DNA will be identical. It is currently postulated that all humans inherit their mitochondria from a single female X chromosome. This is often called as a mother mitochondria or a mitochondrial Eve. As per the current theory, mitochondria were once bacteria and their genes resembled a few genus of bacteria. Way back in the past, when cells engulfed the mitochondria, if cells were stronger, mitochondria were digested. When mitochondria was stronger, it killed the cells. In some rare cases, the cell and mitochondria developed a symbiotic relationship, and this symbiosis was mitochondria supplying energy to the cell and cell supplied nutrition in return. Acting at mitochondrial level, the effects of molecular therapies have been found to be age regressive, performance enhancer, useful in COPD, cancers, allergies and numerous other conditions like diabetes, hypertension, age reversal, general wellness, etc., etc., etc. Certain pharmaceuticals also jolt the mitochondria for reset. Methotrexate in low doses, vitamin C IV in high doses, ivermectin 24 to 72 mg daily. In essence, mitochondrial imbalance is what causes a plethora of conditions labeled together as autoimmune disorders, and only now we are realizing that even malignancies form a part of the same spectrum of autoimmune disorders. Now let us see diabetes, arthritis, myocardial infarction. Can you see the common thread? Do you catch the common thread? Here we go again. Hypertension, obesity, hypothyroidism, PCOD, malignancies, demyelinating disease, ischemic heart infarct. All these are related and move from one end of the spectrum to the other. To understand how this works, we have to get back to the basics. And here comes the relearning, which is very essential and very important. We have been seeing the illustration of one cell, one nucleus, one mitochondria. That is what is taught to us in physiology, that is what is taught to us in biochemistry, and that is what is taught to us in our basic cellular biology. And this is the picture which is in the textbook 8th biology book, 2 BSc zoology book, 2 our medical textbooks of histology. What if I tell you that this is absolutely incorrect? Except for mature RBC, which contains 0 mitochondria, an average cell contains 100 to 5000 mitochondria each. No body cell contains less than 100 mitochondria per cell. A cardiac muscle will have 5000 to 8000 per cell. This you just download on the internet after electron microscopic pictures have come up, because heart needs larger amount of energy and ATP production. Each liver cell will have 30 to 40,000 cells, 30 to 40,000 mitochondria. A neuronal cell, a single cell may have up to 1 lakh plus mitochondria. Over a period of time, these mitochondria assume greater responsibilities than just ATP production and energy. Cell multiplication, apoptosis, cell death, immune system, aging and telomere length, which is also indicator of cell length, cell health. So, all these functions were taken up by the mitochondria, and if mitochondria becomes rogue, uncontrolled cell multiplication will cause cancers, decreased cell death will cause aging, disturbed immune status will cause RA, psoriasis, SLA, etc., and shortened telomere length will cause physiological aging. So, the picture shows you what all disorders can a rogue mitochondria do, and thus it means that as rheumatoid arthritis, autoimmune disorders and cancers are related, there could be some sort of an effective management of all these, which moves away from the chemotherapy, radiotherapy, biologicals, and the direction in which the current pharmacopoeia is moving. Cure may not be the correct word, but control will express it better. In such cases, mitochondria must be reset. What does mitochondrial reset do? Mitochondrial reset has been studied in autoimmune disorders, neuropathies and cancers. Results so far in my hands and those of other pioneers in this field has been extremely encouraging. Mitochondrial reset switches, which actually reset the mitochondria in the order of efficiency high to low, are number 1, extracorporeal blood oxygen ozonization without plastic renal filters, major water chemotherapy, hydrogen water bath, hypothermia at minus 170 degrees for 180 seconds, hydrogen bubbled IV infusions and hyperthermia. This is a hydrogen water bath. This is the health center that I run. We can see that machine is bubbling, and this is a powerful high volume hydrogen water bath, where you can see that hydrogenated water is coming, and one can take a bath in the pool, dousing oneself with hydrogenated water, which is an extremely high antioxidant potential. I am a normotensive individual, but due to travel to high altitude, I suddenly developed hypertension. The following slides tell a story and incident that happened to me last year. On 11th April, 6 a.m., before I starting morning walk, I felt a little flushed and uncomfortable. So I took my blood pressure and I was shocked. It was 163 by 98, though my pulse, which was normally 68, was 77. I had just returned from my tour of Nepal a day back. So rather than go for my walk, I went and got my hydrogen drip done with vitamin C, and immediately after the drip, the same Thursday 11th, my blood pressure is 144 by 90. So we can see 8 mm of diastolic and 20 mm of systolic reduced within 45 minutes. Subsequent pictures are daily BP recordings, no medications were taken, even now I don't take medications. The watch beside the BP machine shows the dates and times. So from 149 by 89, the BP came down to 125 by 85 the next day, and then on 13th it was 103 by 69. So from between 11th to 13th, 2 days, my BP came down from 163 by 98 to 103 by 69, and my pulse rate stabilized at 68, which is my normal pulse rate. 60 mm systolic and 30 mm diastolic pressure reduced in just 48 hours with no further medication. What did I take? The infusion was 2 grams of vitamin C, 1.2 grams of glutathione, 1 ampule vitamin B12, 1 ampule polybion, 600 ml per minute of 99.99% of pure hydrogen bubbled in the infusion. So you can, this is Sunday 28 December 2005, and you can see my blood pressure in the morning, 67 is my pulse, and 120 by 77 is my blood pressure. I am trying weekly hydrogen infusions in about 26 hypertensive patients, and their antihypertensive drugs are dramatically reduced. Later, I experimented on intra-articular injection in osteoarthritis of hip and knee by combining ozone and hydrogen with remarkable results. You can see in this picture a hip joint being injected with hydrozone, and you can see how the hip joint distracts by injection of these molecules, and the movements did improve dramatically. This is a lady of 74 years old age with a knee joint with a very bad medial compartment osteoarthritis, varus knee, who did not want knee replacement at any cost. You can see that 2024 was the knee X-ray taken, and after hydrozone and EBOO, within 6 months you can see her knee joint space has started reappearing. Same patient, and you can see the dates. I am putting the 2 X-rays together for you. You can see on 2nd of April and 4th of November. So from April to November, you can see the difference. No biologicals, no PRPs, only hydrozone, EBOO and nutraceuticals. This is a video that shows an EBOO procedure in a rheumatoid patient. The blood from the donor site is taken and it is perfused with ozone, and you can see the difference in color, how the dark blood has become bright red and how it is ozonated. You can see the various deformities of the patient as she is getting the therapy. This is a demonstration of EBOO. We inject evenflon on the donor site, and then this is connected to the tube. The tube goes through the perfusion pump. The pump is switched on and the blood is sucked, which goes up to the tube. The speed is regulated and increased, the tourniquet is continued on. Heparin is also attached to the perfusion pump, the infusion port, and as the blood goes into the bottle, it becomes bright red. The recipient site is now again perfused, and we can see that the color of blood that is coming out is way far brighter than it was when it was taken out of the donor site. And as we are using very high doses of ozone, something like 4.5 lakh to 8 lakh microgram of ozone directly going into the blood without any membranes and without any plastic filters, the benefits of ozone reach the patient. Waste, if any, is bubbled out and is collected in a separate bottle. This particular patient is a medical doctor, and you can see the color difference between the input and output ports, and this is very useful in autoimmune infections, HIV, allergies, post-cancer rehab, and even in post normal people, sportsmen, models for performance enhancement. So, we also found out that blocks and ozone MAHT EBOO with early function speeds up bone healing dramatically. This was a lady 66 years old who was originally from Italy, came to Amritsar on a holiday, fell down in a bathroom and had a transverse fracture at the subcontract level. And the first thing she did was to send the X-ray to her doctor in Italy because she was not confident about the doctors in Amritsar. Now you can see the message. The X-ray is posted and the first reply is DH is perfect, but the patient does not want surgery, pain, block and walk. Dr. Gulia Silvestri asked, where is it possible in Amritsar? And there I send the message, send him to Deepak Sarhotra, he will walk the patient in 30 minutes. And as the patient started walking immediately after the injection, and there is a testimonial to me.
Prakash, such a blessing to know you through my dear doctor, Dr. Julia Silvestri, that
So the patient sent me a voice message immediately after she started walking. This is her. And you can see how she is walking within 7 days of fracture, and this one is after 10 days of fracture when she is practically carrying her walker. That's her on sticks within 3 weeks and on a single stick in less than 4 weeks of the plaster. The radiological evidence of union, 3rd February 2024 is the fracture, 24th March 2025, March 6, 2024 is the union. So, February 3rd to March 6th, 1 month and 3 days, the fracture is united. You can see the name of the patient, the dates and the X-rays. And this she sent me exactly in 65 days, how she was back to absolute normal, which really made my day and made me happy. Take home message, be aware of rogue mitochondria and the detrimental effect on body at cellular and immunological levels. Learn to reset the mitochondria by less expensive methods and less efficient methods than whole body cryogenic therapy. Ozone is less understood and hydrogen is yet to be fully discovered medical molecule. Master ozone and hydrogen and you can conquer many unconquerable issues. Numerous conditions can be treated with these methods and we need much more research and studies on this and these methods. Hundreds of therapists are using hydrogen and ozone IV therapies presently, and results so far have been outstanding. All therapists are welcome to join us in the studies and let us change history and leave footprints on the sands of time. Feel free to message me on the number given here for scientific data, references, videos and publications. 600 pages of publications on ozone are available, and should you be interested, please message me in the number 97910 20615 and I will be happy to share scientific data with you. The message is only for doctors and orthopedic surgeons, not for patients. The book is published by AOS, and we also have a detailed 4-month course on molecular therapeutics. This should be probably the last lesson in that course. Thank you very much for listening to the talk and hope you have benefit from it. Thank you. All the best. Goodbye.